Hello, and welcome to Mindful Health Fitness, the channel where we share tips and tricks to help you live a healthier and happier life. In today's video, we're going to talk about the top 6 inflammatory foods to avoid for arthritis. Arthritis is a condition that causes pain and inflammation in the joints, and it can affect anyone at any age. There are many factors that can trigger or worsen arthritis symptoms, such as stress, injury, infection, or genetics. But did you know that your diet can also play a role in how you feel? Some foods can increase inflammation in your body, which can make your joints more swollen, stiff, and painful. On the other hand, some foods can help reduce inflammation and improve your overall health. So, what are the foods that you should avoid if you have arthritis? Let's find out. The first food to avoid is red meat. Red meat is high in saturated fat, which can increase inflammation and cholesterol levels in your body. Studies have shown that people who eat more red meat have higher levels of inflammatory markers in their blood, and they are more likely to develop rheumatoid arthritis, a type of autoimmune arthritis. If you love red meat, try to limit your intake to no more than 1 serving per week, and choose lean cuts or grass-fed beef. You can also substitute red meat with other sources of protein, such as chicken, fish, legumes, or nuts. The second food to avoid is high-fat dairy products. Dairy products can be good for your bones and teeth, but they can also be bad for your joints if they are high in fat or sugar. Full-fat dairy products, such as milk, cheese, butter, and cream, contain saturated fat and omega-6 fatty acids, which can worsen inflammation and joint swelling. They may also trigger an immune response in some people who are sensitive or intolerant to dairy proteins. If you have arthritis, opt for low-fat or non-dairy alternatives, such as almond milk, soy milk, or oat milk. You can also try yogurt or kefir, which contain probiotics that can help balance your gut bacteria and reduce inflammation. The third food to avoid is added sugar. Added sugar is found in many processed foods and beverages, such as sodas, candy, desserts, cereals, sauces, and dressings. Added sugar can spike your blood sugar levels and increase inflammation in your body. A 2020 study found that people who drink regular sugar-sweetened soda have an increased risk of rheumatoid arthritis. Added sugar can also lead to obesity, diabetes, heart disease, and other chronic conditions that can affect your joint health. If you have a sweet tooth, try to limit your intake of added sugar to no more than 25 grams per day for women and 36 grams per day for men. You can also use natural sweeteners, such as honey, maple syrup, or stevia. The fourth food to avoid is salt. Salt is essential for many functions in your body, but too much of it can be harmful. Excessive salt intake can raise your blood pressure and increase your risk of developing autoimmune diseases such as rheumatoid arthritis. It can also cause fluid retention and swelling in your joints. The recommended daily limit for salt intake is 2,300 milligrams, mg, which is about 1 teaspoon. However, most people consume much more than that from processed foods and restaurant meals. To reduce your salt intake, avoid canned foods, frozen pizzas, processed meats, and other high-sodium foods. You can also flavor your food with herbs and spices instead of salt. The fifth food to avoid is nightshade vegetables. Nightshade vegetables are a group of plants that include tomatoes, potatoes, eggplants, peppers, and chili. These vegetables contain a compound called solanine, which may interfere with the gut microbiota and indirectly increase inflammation. However, there is no conclusive evidence that nightshade vegetables cause or worsen arthritis pain. Some studies suggest that they may actually have anti-inflammatory properties. If you suspect that nightshade vegetables may aggravate your symptoms, you can try eliminating them from your diet for a few weeks and then reintroducing them one by one to see how you react. The sixth and final food to avoid is alcohol. Alcohol can have both positive and negative effects on your health, depending on how much and how often you drink. Moderate alcohol consumption, which is defined as 1 drink per day for women and 2 drinks per day for men, may lower the risk of rheumatoid arthritis and cardiovascular disease. However, excessive alcohol consumption, which is more than 3 drinks per day for women and 4 drinks per day for men, can increase inflammation and damage your liver, kidneys, stomach, and joints. If you have arthritis, it is best to limit your alcohol intake or avoid it altogether. You can also drink plenty of water to stay hydrated and flush out toxins from your body. So, these are the top 6 inflammatory foods to avoid for arthritis. By eliminating or reducing these foods from your diet, you may notice an improvement in your joint pain and inflammation. However, remember that diet is not the only factor that affects your arthritis symptoms. You also need to exercise regularly, manage your stress levels, get enough sleep, and follow your doctor's advice to keep your joints healthy and happy. Thank you for watching this video. If you found it helpful, please give it a thumbs up and subscribe to our channel for more health and fitness tips. Also, let us know in the comments below what other topics you would like us to cover in the future. Until next time, stay mindful and stay fit.